I've gathered my supplies. Hello, my name is Dulce and I'm a student nurse with Kilmer College, and today I'm going to be doing a head-to-toe assessment. Is that okay?
Yes.
Okay. Gonna perform in hygiene. Can I get your name and date of birth, please?
Leslie Gallegos, 4/16/99.
Do you have any allergies?
No.
Okay, before we get started, I'm gonna raise the height of the bed, and I'm gonna ask you a few more questions. Do you know where you are?
At school
Can you tell me why you're here?
for an assessment.
And can you tell me who the current president is?
Trump.
Okay. Do you have any issues or concerns with your hygiene? Are you bathing regularly?
Yes.
Okay. And how many times a day are you eating?
3.
Would you say those are nutritional meals?
Mm-hmm.
Okay. How do you feel today?
Good.
And I'm going to just kind of assess your skin. Can I see your arms? Okay. Can you tell me when was the last time you had a bowel movement?
Yesterday.
And when was the last time you urinated?
Yes. About 30 minutes ago.
Okay. And did you have any issues at all with your bowel movement or urinating? Okay. Do you have any pain?
No.
Do you have any cough?
No.
And do you use any assistive devices to get around?
No.
What about any hearing devices?
No.
Okay. I'm now going to get your vitals. Okay, I stopped feeling the brachial pulse at 1:30. I'm gonna let that sit for about a minute. Have you had anything hot or cold to drink in the last 30 minutes? Okay, this thermometer is gonna go underneath your tongue. Temperature is 98.6 and oxygen is 99% in room air. Can you tell me your weight and height?
5'4", 200.
Okay, height is 5'4" and weight is 200. And I'm gonna get your blood pressure. I've sanitized my stethoscope. Okay, blood pressure is 128/70. Okay, I'm gonna assess your heart rate. Okay, heart rate is 72 and respirations are 18. I'm going to now start with the assessment of your head. Is it okay if I touch you? Can you smile for me? Can you frown? Okay, I'm gonna go ahead and start. Can you put your head down a bit? Do you feel any pain when I do this?
No.
I'm just gonna assess for distribution of the hair. I'm going to assess your sinuses. Do you feel any pain or tenderness when I do that? Okay. Using my pen light, I'm going to assess your pupils. Okay. I'm gonna have you look at my pen light and then look at the bed behind me. Look at my pen light and then the bed. Okay. And if you could just follow my pen light. Okay, and then I'm gonna bring it to the side of your head. Let me know when you see it.
See it.
Okay. I'm going to look into your ears. Do you use any hearing devices?
No.
Okay. And I'm going to assess your nares. Can you close one nostril and breathe with the other? Okay, can you do the same on the other side? Did you have any issues breathing? Okay. I'm going to pull down your lower eyelids. Okay, can you open your mouth for me? And you stick your tongue out, please. Okay. I am now going to do a whisper test. I'm gonna step behind you. I'm gonna have you cover one ear and I'm gonna whisper 3 words and then you're gonna repeat them back to me. Okay. Okay. Can you cover your right ear? Purple bed shoe.
Purple bed shoe.
Okay, we're gonna do the same on the other side.
Bottle car blue.
Okay. Okay, so I'm going to, if you can just look up for me, I'm going to assess your neck. I'm looking for JVD, your cervical lymph nodes. Do you feel any pain or tenderness? Okay, and your carotid pulse. Okay, can you shrug against my hands? Thank you. And then can you do a circular motion with your neck? We're assessing range of motion. Can you go the other way? Okay, any pain or tenderness? And so now I'm gonna move to your chest. I'm gonna have you turn and face your back to the wall, to the window. I'm just assessing your, for equal chest symmetry, posterior and anterior, and equal rise and fall of the chest. Every time I put my stethoscope on you, will you take a deep breath?
Okay.
Okay, will you turn around, please? I'm going to do the same. I'm gonna assess your PMI. Okay, do you feel any tenderness when I do this? I'm going to have you lay down, please. This is gonna be an assessment of the abdomen. I'm gonna first inspect, and I'm gonna listen to your bowel sounds. Then I'm going to percuss. Okay. Do you feel any pain or tenderness when I do this?
No.
Okay. And you said no issues with bowel movements or urinating, okay? I'm gonna have you go ahead and set up for me. Can I see your hands? I'm going to assess your capillary refill. Capillary refill is less than 3 seconds. Can you squeeze my fingers? And I'm gonna assess your radial pulses. Okay, radial pulses are equal and 2+ bilaterally. I'm going to now assess your lower extremities. Feel your popliteal pulses. No. Posterior tibial. Okay, I'm gonna just assess for temperature and for any edema. Can you push, pull, and I'm going to assess capillary refill of your lower extremities. Using my pen light, I'm gonna look in between the toes. Okay, now we're gonna do some range of motion exercises. I'm gonna have you stand up, and if you can just do what I do. Put your hands out, put your palms up, bring your hands to your shoulders, extend your arms, and then move them in a circular motion. Can you put your hand to the back of your head, and then to your back, and can you bend over? I'm gonna assess your spine. Okay. Can I have you do a squat, please? And I'm also gonna assess the range of motion of your lower extremities. Stick your leg out, do circular motion, same with the other side. Okay, bring it back, and we're gonna go out, same with the other side. I'm gonna have you bring your heel to your knee. Okay, we're gonna do the same on the other side. And if you can please bring your knee over your other knee, same with the other side. And I'm going to have you walk 5 steps, heel to toe. Okay, can you walk back this way? Okay, you can have a seat. Do you feel safe and comfortable? Okay. Remove my gloves, perform hand hygiene, lower the height of the bed, and I'm going to document my findings. Okay. Client is alert and oriented ×4. She is calm and cooperative. No concerns with hygiene or nutrition. No issues with bowel movements or urination. Their vital signs were stated during assessment. There's no pain, no cough, no use of assistive devices or hearing devices, no bumps or lumps to the head, equal hair distribution. The pupils are 2 millimeters in size, with they're round, reactive to light with accommodation. The cardinal and peripheral fields are intact, and there is no redness or drainage to the external or internal ears. The client passed the whisper test 3 out of 3. The nares are patent, no redness or drainage. Oral mucosa pink and moist. Eye conjunctivitis pink and moist, and the sclera is white. There's equal rise and fall of the chest, equal chest symmetry, anterior and posterior. There is clear lung sounds to all lobes, bilaterally, posterior and anterior, and all the heart sounds are regular rate and rhythm to all landmarks, with the apical pulse regular rate and rhythm. The carotid pulse is 2+ bilaterally. No JVD, no, all sinuses and lymph nodes are non-tender, and abdominal sounds are normal active, no pain or discomfort in all quadrants. To palpation, abdomen is flat, non-distended. A full range of motion of upper and lower extremities. Cap refill is less than 3 in all extremities. There is no edema to the legs, warm temperature, cap refill less than 3 seconds to the lower extremities. No issues with between the nails, equal strength grip to upper and lower extremities bilaterally. Full range of motion of the upper and lower extremities. No issues or concerns with gait, coordination, or balance. And equal facial symmetry, speech and hearing. Speech is clear, hearing is intact, skin is appropriate color for ethnicity, good hair, equal hair distribution, no pain, no cough,